Researchers at the University of Arizona believe the liver may hold the key to new preventive type 2 diabetes treatments. According to the Centers for Disease Control, diabetes affects 34.2 million Americans. An additional 88 million people over the age of 18 are pre-diabetic or at risk of developing diabetes. This year marks the 100th anniversary of the discovery of insulin, a scientific breakthrough that transformed type 1 diabetes, once known as juvenile diabetes or insulin-dependent diabetes, from a terminal disease into a manageable condition. Today, type 2 diabetes is 24 times more prevalent than type 1. The rise in rates of obesity and the incidence of type 2 diabetes are related and require new approaches, according to University of Arizona researchers who believe the liver may hold the key to innovative new treatments. The researchers says that all current therapeutics for type 2 diabetes primarily aim to decrease blood glucose. So they are treating a symptom, much like treating the flu by decreasing the fever. In two newly published papers in the journal Cell Reports, researchers from Washington University in St. Louis, the University of Pennsylvania, and Northwestern University outlined a new target for type 2 diabetes treatment. The research lab has spent the last 9 years working to better understand the correlation between obesity, fatty liver disease, and diabetes, particularly how the liver affects insulin sensitivity. The researchers says that obesity is known to be a cause of type 2 diabetes, and for a long time we have known that the amount of fat in the liver increases with obesity. As fat increases in the liver, the incidence of diabetes increases. This suggested that fat in the liver might be causing type 2 diabetes, but how fat in the liver could cause the body to become resistant to insulin or cause the pancreas to oversecrete insulin remained a mystery. The researchers focused on fatty liver, measuring neurotransmitters released from the liver in animal models of obesity to better understand how the liver communicates with the brain to influence metabolic changes seen in obesity and diabetes. The researchers found that fat in the liver increased the release of the inhibitory neurotransmitter gamma-aminobutyric acid or GABA. They then identified the pathway by which GABA synthesis was occurring and the key enzyme that is responsible for liver GABA production, GABA transminase. A naturally occurring amino acid, GABA is the primary inhibitory neurotransmitter in the central nervous system, meaning it decreases nerve activity. Nerves provide a conduit by which the brain and the receptor body communicate. That communication is not only from the brain to other tissues, but also from tissues back to the brain. When the liver produces GABA, it decreases activity of those nerves that run from the liver to the brain. Thus, fatty liver, by producing GABA, is decreasing firing activity to the brain. That decrease in firing is sensed by the central nervous system, which changes outgoing signals that affect glucose homeostasis. To determine if increased liver GABA synthesis was causing insulin resistance, the researchers pharmacologically inhibited liver GABA transminase in animal models of type 2 diabetes. Inhibition of excess liver GABA production restored insulin sensitivity within days. Longer-term inhibition of GABA transminase resulted in decreased food intake and weight loss. Researchers wanted to ensure the findings would translate to humans. The findings are the foundation of an Arizona Biomedical Research Commission-funded clinical trial currently underway at Washington University School of Medicine in St. Louis. The trial will investigate the use of a commercially available Food and Drug Administration approved inhibitor of GABA transminase to improve insulin sensitivity in people who are obese.